Okay, well, let's get more on the government's response, ongoing response to the coronavirus pandemic, and we can talk to the Secretary of State for Health, Matt Hancock. Good to see you this morning. Look, we are, according to the experts, and it seems pretty clear from looking at the figures where we are now at almost 9,000, that we are hurtling towards hitting 10,000 coronavirus-linked deaths this weekend. That's really a horrific figure.
Well, look, my job as health secretary is to protect life, and this underlines how important it is for everybody to follow the social distancing rules and to stay at home. Just as your reporter was saying there, if anybody thinks that it's okay to slacken up when it's clear that although there are signs of the curve flattening, which is good news, and we shouldn't throw away that good work of flattening the curve. But it's still clear that the virus is spreading in the community, and we've got to make sure that we stop that. And so people really do need to stay at home this Easter weekend.
Look, I know it has been made very clear throughout all the briefings that the government has been following scientific advice. That's understandable. You've got to rely on the experts. But nevertheless, do we think now, with a little bit of hindsight, that advice was not necessarily right, that we didn't take enough stringent action early on?
No, as you say, we followed the advice, and we also looked abroad at what was happening, and we made those decisions. I think the right decisions to bring in this lockdown at the right time. And what matters, and what I concentrate on every single day, and what we spend our time working on, is what is the best route now, and what should we be doing next. And the very clear evidence from what's happening, from if you look at the number of cases and the number of people going into hospital, what is clear is that the measures are working, but we're not there yet. And so people should take heart that the measures are working, because it is bringing this epidemic under control. But also be resolute in that we're not there yet, and so we need this to continue. And of course, we'll keep reviewing that advice, and the scientific advisory group are meeting next week. But for this weekend, the message is really crystal clear, which is to stay at home.
In terms of that messaging, I mean, you say it's crystal clear. I've got to say, from a personal perspective, I've not found it difficult to understand. But there are people who've said to me that the government has not been specific enough, and particularly when we're looking at last weekend, and no doubt we will see some of it this weekend, sadly, of people not really following the rules. Do you have to be even more precise and say, if you go out this weekend, go out for an hour tops, you must keep moving, you cannot sit down, you cannot have a barbecue, you can't sit down with a flask of tea, whatever it is? Do you have to be absolutely crystal clear on all that advice?
Well, I think we have been. I was asked last weekend whether it was okay to stop and have a picnic, and the answer to that is clearly no, because the reason that you can go out for exercise is to get exercise, and because of the very positive benefits that you get from exercise. So we have been crystal clear, as you say. The vast majority of people are following the rules. I'm also really pleased over the last week or so to see that the number of people following the rules, which we track, and the proportion, there hasn't been a slackening off. People are continuing to follow the very stringent rules, despite the impact that it has, and we understand that. I understand it, and so actually the amount of adherence to the social distancing rules is something that I'm very pleased about. Of course, I always want to see everybody following, and there is a very small minority who flout it. But actually, if you look at the figures, and if you look at the data that we use to try to measure these things, there is a very, very high degree of support for the measures and adherence to the measures. And so I want to thank people who do follow the measures. And then, of course, along with the police, we try to get that proportion increasing all the time.
There is some very confusing messaging, not from the government, but from all these sort of academics and things in all this when we've been talking about a vaccine, because we heard only a week or so ago, some experts were saying a vaccine was going to be middle of next year. In the Times today, there's this article coming from a very high-ranking scientist in Oxford talking about the possibility, absolutely pushing us to the limits, but we might be able to get something into production by September. Clearly, you're across all the research and all the work that's going on here. What do you understand a realistic timetable to be?
Well, I am engaged in all of that, and I know quite a lot about the Oxford project, and it is really great to see some hope especially on the front page of the newspapers. But the way that I think about it is as follows: we will put all the resources we possibly can into getting a vaccine because of the massive benefits that we'd have to have a vaccine. We're also putting enormous resources into making sure that when a vaccine comes about, if and when, then we can manufacture enough here to be able to get it to everybody as quickly as possible, because it's not just about discovering the vaccine and then checking that it's safe, but it's also then about manufacturing it. And we have got vaccine manufacturing capability in this country, but it needs expanding. So we're doing that in parallel whilst we wait for the scientists to develop a vaccine that we're happy with. And then essentially to make sure that whatever the outcome of the science, however fast that happens, we are ready to get the regulatory approvals, ready to get the production, and ready to get it logistically to everybody who needs it. So in a sense, my job is not to have a view on how fast that will happen. I think the truth is it's impossible to know, but it's nice to see some hope, as I say. My job is to make sure that as and when the scientists make their breakthroughs, and there's no way I could do the science, I leave that to them, the country is ready to step up, pick up the science, turn it into mass production and get it out, and that there aren't any barriers in the way, whether financial or regulatory or in terms of capabilities, to the scientists making the fastest progress that they possibly can.
But there are some barriers in place, aren't there? I mean, there's been a lot of talk about this plasma therapy in order to combat COVID-19. The government has not approved trials for plasma therapy. Why is that?
Well, if an individual clinician recommends it, then that can be used. And we are expanding the trials of different medicines, different therapies all of the time. In fact, we have one of the biggest trials program in the whole world going on in this country. For instance, you might have heard of hydroxychloroquine, which is much discussed. We have one of the biggest trials of hydroxychloroquine in the world. And in the same way that we follow the scientific advice on social distancing, so too, we're determined to follow the scientific advice and follow the science on making sure we get these treatments in, get them within a clinical trial so that we collect the data, we really understand what works and what doesn't work, what sort of dosage applied to which patients at what time, so that we can then learn from them and treat more people more effectively. So the one that you mentioned is something that I've seen and I know is available to the right people on the NHS where that's clinically appropriate. Those decisions for any individual patient, of course, have got to be made by the clinician who's treating them.
Look, I want to talk to you about PPE in just a second. Before we get to that, though, can we talk about the number of people on the front line who have caught and sadly passed away from COVID-19? I mean, what sort of figures are we looking at the moment?
Well, at the moment, 19 people have died from the NHS family. For them it is it's a heartbreaking story, and I know that it affects everybody who works in the NHS, to see their colleagues die. I think that the important thing is to work out to what extent people contracted it in the line of duty, so to speak, because of course, people can have caught it from all sorts of different reasons. And you mentioned PPE. We aren't aware of any link from shortages of PPE to any of these deaths. But my heart goes out to their families, and I've said already that I think the fact that such a high proportion also are from people who moved to this country to work for the NHS is really heartrending, to see people who've literally given their lives for the NHS, who moved here to give that service, and I think we should pay tribute to them.
Well, absolutely. I think everyone would agree with you on that. But in terms of the PPE, there was. Now, I heard you in the news conference last night. I have to say, it did strike me a little bit. And no doubt it's a valid point to say, look, the PPE is here. There's a logistic issue, getting it around to the 58,000 bases or whatever you mentioned today. But there has been, and certainly reported on Twitter and elsewhere, a sense of anger in that you did say, however legitimate it may be, about saying, you only wear the PPE when you need to, only use the pieces that you need to. When you're on the front line, when you're actually dealing with this, perhaps you are getting through more PPE than may be absolutely necessary, but we can't criticise people for doing that, can we?
No, and I won't criticise people for doing that, but I will reiterate how important it is to use exactly the right amount of PPE. As you say, that it's an important point to make, because PPE is a precious resource, and we need to make sure that it's used appropriately, that everybody has it, that every single person gets it, which is why it's such a complicated logistical exercise, getting millions of pieces of PPE to the right person and to the millions of people who work across health and social care.
Can I mention something to you that I spoke earlier on, a couple of hours ago, to Dr. Julian Tang, who is an expert in these respiratory conditions and how they are spread. And he said, although PPE is very important, it was at the bottom of his sort of inverted triangle of the measures that you need to do to stop these sort of issues, particularly within hospitals and care homes. He said that actually ventilation was much more important, even using ventilation systems better, but also, literally opening windows can actually have a real impact on how this virus is being spread.
Well, I think there's a lot of wisdom in that. Of course, the top priority, the absolute top priority, is making sure that NHS capacity is always above the demand for it. I mean, one of the things that we've managed to achieve during this crisis is always ensuring that there's enough capacity in the NHS to treat everybody and give everybody the top class treatment that they need. So that's the absolute number one. Ventilators is clearly a part of that. Getting testing right is incredibly important. There's a whole program of work all the way through all the measures, and we've just got to. We work night and day on doing the very best we can on all of them.
Can I finish off? I want to ask you about the lockdown. It's been well reported, and some experts have come forward and said, look, it looks like the lockdown will have to be extended. We haven't had that definite word yet. Don't we need that as soon as possible? We need to be told, rather than having this waiting period of 3 or 4 days. We need to be told now, don't we, that this is going to be extended through to the beginning of May.
There's only one thing that matters when it comes to people making decisions about what they're going to do this Easter weekend. There's only one thing that matters for that. All the other discussion is important, and I'm quite happy to answer questions about it. But there's only one thing that matters in terms of what people do this weekend. And every single person can play their part in the national effort to defeat this virus by staying at home. That's what I'm doing, and that's what everybody should do.
Secretary of State, good to talk to you. Thank you.
Thank you.